Hello, you are watching Aaj Tak AI and I am AI anchor Sana. Let's have a look at the AI health update. Today let's shed some light on hearing health. Hearing health is crucial for our overall well-being and daily interactions. Regular maintenance involves protecting ears from loud noises, avoiding damaging environments, and monitoring audio device volume levels. Regular checkups with audiologists help detect potential issues and manage them promptly. Healthy habits like a balanced diet and regular exercise can also improve hearing health. Cultivating awareness about hearing function contributes to a society that values and prioritizes overall auditory well-being. To know more about hearing health, watch this video till the end. So today we have Dr. Savyasati Saxena, consultant and HOD, ENT, Fortis Noida.
Thank you. First of all, I'd like to thank you, Sana, for having me on the show on the occasion of World Hearing Day.
My first question is to you, doctor, that how much important is hearing health?
I would like to say that whenever we talk about health, we talk about physical health, mental health, psychological health, but we never talk about hearing health. Hearing is as important for health as any other part of the body. Hearing is one sensory system that allows us to know what is going in the world or what is going with all the people. Without hearing, a person can feel isolated, lonely, and it can lead to depression, especially in elderly.
My next question to you is, what are the types of hearing loss?
First of all, I'd like to say types of hearing loss. There are 3 types of hearing loss. First of all, there is conductive hearing loss, the loss in which the sound cannot go up to the hearing system of our body, the ear and the brain system. Second is the sensory neural hearing loss, when the sound is able to go through that, but it is not able to perceive or relay to the brain system. And third, we have a mixed type of hearing loss in which we have a combination of these. The reasons for hearing loss can be, in case of conductive hearing loss, it can be simple wax in the ear, any infection of the outer ear, perforation of an eardrum, infection of middle ear, such as acute otitis media, fungal infections of the ear, somebody hit in your ear which causes rupture of your drum or the disruption of your ossicles. In sensory neural hearing loss, it can be because of aging process, it can be because of noise-induced trauma, it can be because of some viral infections, it can be because of some drugs which you take which are hazardous to your health, which are hazardous to your ear, it can lead to ototoxicity. Maybe some kind of some CKD patient, that is chronic kidney disease patient, chronic liver disease patients. And in mixed hearing loss, it can be a combination of any.
My next question to you is, what are the symptoms of hearing loss?
Okay, now coming to the next question, Sana. The signs of hearing loss, many times the person does not even know that he is suffering from hearing loss. I tell you what to observe for. If you ask any person to repeat again to hear what he or she has said, if you have trouble hearing, especially in noisy places, if you have trouble understanding speech, again, especially now noisy places, if you have trouble, if you have problem in communicating to your peers while being in a group, if you raise the volume of TV or music to higher than the normal level what other people are listening to, if you have a constant worry that you might miss the horn or you might miss the doorbell or you might miss the telephone and you might not be able to hear it, then these are the signs that you might be suffering from a hearing loss disorder. And then you should seek a medical attention right away. Besides this, one more type of hearing loss is sudden hearing loss, in which a person might have a deterioration of hearing over a period of few hours or a day associated with or without dizziness, tinnitus, that is called ringing sounds, and vomiting. If you are having any such kind of situation, you should seek a medical attention right away, because many times it can be reversed and the patient can restore hearing very well.
Doctor, my next and very important question is to you. How can a change in lifestyle improve hearing?
Okay, now that's an important question, Sana. How can lifestyle improve? Lifestyle improvement can lead to improvement hearing. I tell you 6 points for this. First of all and foremost is take care of your nutrition. A diet rich in vitamins, a diet rich in fruits, vegetables, and a balanced diet is very important for your health, especially the hearing part also. However, a diet more in cholesterol, having more of cholesterol, building food like fat, artificial junk food, artificial colors and flavors like jam, sauce, like that have to be avoided. Secondly, do some light exercise. Cardiovascular exercises are the best, but Indian yoga, aerobics, they are the best. You must do this, and hearing is definitely going to improve. Third point, avoid smoking. As smoking can cause all the organs, it affects ear also very badly. You should avoid it as much as possible. Thirdly, along with that smoking, I would like to avoid drinking also. Alcohol also has a bad effect on your hearing, and that has to be avoided. Fifth point, avoid loud noise or exposure to noise for a very longer duration. If in any case you have to use, take frequent breaks in between or use hearing protection devices. Last but not the least, take regular hearing test so that you'll be aware that if there is some kind of loss or some kind of disorder which has started in your body, it should be corrected as early as possible.
Doctor, people usually hear loud music. How can this damage our ears?
Now coming to your next question, Sana. How does noise can damage your hearing? Now the potential for hearing damage depends on the type of noise and the duration of exposure. Sounds at or below 70 decibels are unlikely to cause any kind of hearing damage, but sounds which are more than 85 decibels, if given for a prolonged duration, maybe for 5-6 hours or 8 hours per day, can definitely lead to temporary or permanent hearing damage. Sudden hearing loss can also occur for if a person is exposed to extremely loud sounds like the sound of a firecracker bursting around, maybe some bomb explosion, that can lead to sudden acoustic trauma. That usually occurs at decibels more than 140 decibels. Besides that, you can have viral infections which can lead to sudden kind of hearing loss. Because of noise, what happens? The hair cells, which are the sensory organs present in your ears to perceive hearing, they become tired, I will say. They become excessively exposed. So they become weak, and on prolonged duration, they stop working. And that is how you have this kind of hearing loss.
What precautions should we take to avoid hearing loss?
How to protect your hearing? Try to move away from the places where there is loud sound spreading. Try to reduce the volume of your TV or your music system. Try to use hearing protection devices such as earplugs. Now the earplugs are made of rubber. If used properly, they can definitely reduce the volume, not extremely well, but yes, up to the level of 10 to 30 decibels, it can be reduced. Try to limit your time exposure. If you have to hear to some sound, or if you have to attend to some meeting with prolonged duration, try to limit the use. Here I would like to recommend the use of rule of 60. It's a beautiful rule. How can you define that? The total time limit for using a earphone or a headphone or a mobile should not be more than 60 minutes in a day. That too for not more than 60 decibels of the sound, and thirdly at 60% of the volume of your system capacity. If you follow the 60 rule, you will not be having any kind of this problem. Right. Besides that, other protection mechanisms available are that you should have proper immunization, you should maintain good health for yourself. If you suspect a genetic disorder, because hearing loss, we are talking about children also here. If you suspect there can be a child born with congenital hearing loss, you should have genetic counseling beforehand, so that the parents having some genetic disorder which can lead to a child born deaf should not be there. Then regular screening is very important. All the children born should have a neonatal screening for their hearing. Regular hearing screening should also be done for the office employees where they are exposed to excessive loud sounds, such as factory workers or people working in call centers like that. And by default also, any person who is more than 40 should have a hearing check at least once in a year.
Thank you, Dr. Savyasachi, for giving us your valuable time to discuss on hearing health. Do tell us what you think about this video in comments section.